Welcome back to the Garrett Mason Show. I first have to say thank you so much for those of you who have watched the show on YouTube or listened to it on Apple, Spotify, wherever you get your podcasts. We really appreciate it. Last week, we launched our first series of shows. It was a hit. We had a great time producing them. We're looking forward to producing a lot more content. And if you haven't already, please subscribe to our channel on YouTube, download our episodes on Apple or Spotify, wherever you get your podcasts. Follow us on TikTok, X, Instagram, and Facebook. It really helps us out when you're able to do that. So please follow the show wherever you can. We've really enjoyed making this content and are looking forward to making a lot more. This week is election day, and down in DC, everybody's on vacation. As you know, we're entering a full month of the Schumer shutdown. We've seen the White House post all kinds of stuff with Hakeem Jeffries in a sombrero. They've really done a really good job of kind of putting the Democrats on the spot for what they're doing to the country for this complete, unnecessary sham of a government shutdown. I want to walk you through it. I want to try to give you the truth. I want to try to make sure that you understand what's really going on here and maybe give you some ideas on how we can fix it and what's going to happen right here in Maine. But this government shutdown is a complete sham. It's completely unnecessary. It's showmanship politics at its absolute worst. Chuck Schumer is in trouble. Chuck Schumer is being challenged from the left, from none other than Alexandria Ocasio-Cortez. She wants to challenge Senator Schumer for his seat. And Chuck Schumer has to act like a left-wing lunatic to make sure that the voters in New York will still elect him to the United States Senate. That's really the bottom line. But let's walk through all of the performative things and all of the gaslighting that's going on from the Democrats and why this is actually going on. Democrats are trying to tell us that this is all about healthcare, that this is all about Republicans stripping people's healthcare from them and causing premiums to skyrocket. We're going to walk through that. But what this is actually about is about Democrats and their extreme Trump derangement syndrome. It's about Democrats and how they cannot continue to hold up the sham that is the Affordable Care Act. That's what this is actually all about. Democrats have been destroying healthcare in this country for 15 years. And in this government shutdown, they are trying to implement language that was stripped in Medicaid eligibility by the one big, beautiful bill. Democrats will say, and they have continued to say, that under federal law, it is not allowed that illegal immigrants can benefit from Medicaid and Medicare. In fact, we can listen to them say it.
Federal law.
This is Hakeem Jeffries, the minority leader.
The expenditure of taxpayer dollars on providing health care to undocumented immigrants. Nowhere have Democrats suggested that we're interested in changing federal law.
Aren't Democrats demanding health care for illegal aliens?
Maxine Waters.
Democrats are demanding health care for everybody.
Everybody.
I did universal health care when I was mayor, fully implemented.
Gavin Newsom, governor of California.
And regardless of your immigration status. San Francisco is the only universal health care plan for all undocumented residents in America. I'm very proud of that.
Current federal law is clear. Taxpayer dollars cannot be spent on Medicaid or Medicare or the Affordable Care Act related to undocumented immigrants. And not a single Democrat has raised the issue of trying to reverse that federal law.
Raise your hand if government.
This is my favorite. This is the 2019 Democrat debate.
Immigrants.
Every single one of them will cover undocumenteds.
We do ourselves no favors by having 11 million undocumented people in our country be unable to access health care.
Federal law clearly prohibits the expenditure of taxpayer dollars to provide health care to undocumented immigrants, period, full stop. And no Democrat on Capitol Hill is trying to change that law.
We have, of course, J.D. Vance out saying that all we want to do is provide, I say we, a Democrat, provide, care for illegal aliens. That's his language. And of course,
that's just not true what he's saying.
All right, that's good. We can stop it there. But that is a montage provided by the White House of all kinds of Democrats, including every Democrat who ran for president in 2019, raising their hand when asked on stage if their Medicare and Medicaid plans would cover undocumented or illegal aliens. Every single one of them said yes. You saw many clips of Hakeem Jeffries, who is the House Minority Leader who took over for Nancy Pelosi. Many clips of him saying that no Democrat is suggesting that we provide that care. That is a lie. It's a straight up lie. If we can throw up slide 4, please. Slide 4 is a clip from the One Big Beautiful Bill. This is the language that they want to reinstate. And if you notice the date, October 1st, 2026, that is why this is happening. They are panicking because after October 1st, 2026, they're not going to be able to supply this money anymore to illegal aliens. And they are going to the wall for illegal migrants to have health care paid for by you, the taxpayer, and they won't go to the wall for you. They won't do it. This is the language they want to put in. This is the language that they're fighting for. And for them to say otherwise is a complete and abject lie. We actually in Maine have seen illegals get health care right from our own state government. If we can throw up slide 1. Slide 1, this is from the Division of Procurement Services within the Department of Administrative and Financial Services. This was found by the Maine Wire, who once again has done incredible work in finding this information. This is a bill for over $800,000 for one illegal immigrant who is in some sort of care at a group home, at a nursing home of some sort. For one person, $800,000. This is for an illegal migrant. But I think it's important to walk through this particular case itself. Because not only are we providing this money, and I'll give credit to where credit's due. Hakeem Jeffries is right. There is law under the federal government, under the federal law, where you're not supposed to give money to illegals for their health care. There is some law that says that, but it doesn't stop your state government from handing it out. Let me explain how this happens. So, if we can throw slide 1 up once again, if you look on there, this is actually an amendment. This is an amendment for this person's healthcare services. You'll see it's for $43,377. That's how much more it was going to cost. But it's important to know why they had to make that amendment. And if you go to the second part of that slide, you will see that the reason that they're doing this is to include funds for the provider service tax. The provider service tax is how they provide money to illegals for health care and then get you to pay it out the back door. Maine's actually got in trouble for this quite a bit because we completely abused this system and they were forced to actually repeal how they were doing the service provider taxes. This tax, when they charge it, what they're able to do is show the federal government how much was given in this service provider tax, and then the federal government gives them a match for it. So not only are you paying for this person's health care, they're paying a tax on it and then getting a bunch of money from the federal government to provide services to those illegals. That's how they do it. They've done it for years. Sometimes they get in trouble for it, sometimes they don't. But it's a money washing scheme from the highest levels of state government. They are using your money to pull down more and provide benefits to those who don't deserve them. But it's interesting because while they're doing that, providing health care for illegals, we're the ones stuck holding the bag. Play clip 7.
All right, the health insurance industry is an absolute sham. I don't know how I'm paying $1,500 a month for health insurance, but every single person in my policy has a $6,000 copay, which means I've been going to the doctor all year. I thought my copays went towards our premiums and the amount that we had to pay to get coverage. However, it doesn't. My wife just had a serious event. She had to go to the hospital. She had to have life-saving surgery. And we got a bill in the mail from the hospital for over $3,000 for this procedure. And I'm thinking back, I'm paying $1,500 a month for this health insurance. I've personally paid thousands of dollars over the course of this year in copays for myself and stuff that I had to go to the doctors for. So I'm sitting here thinking, I'm going to spend $1,500 a month for the next 12 months. What is that? 18 grand. And then I have to spend $6,000 a person just to get them to cover things. So you're looking at, we have 5 people in our family. If all of us have to go to the hospital, that's $30,000 in copays that we have to pay on top of the $18,000 in monthly charges to actually get coverage. As a father of 3, I'm strongly considering canceling our health insurance policy, which feels very irresponsible and wrong, but I can't remember the last time I spent over $48,000 in a year in health costs between copays and health insurance and all of this stuff. If I just pay cash, I'm never going to pay anywhere near that amount. For instance, the surgery my wife just had, if we paid cash on that surgery and we didn't have insurance, it would have ran us about $1,200. But because we had insurance and the insurance wasn't going to cover it, we have to pay what the insurance was going to pay, which is over $3,000. Are other families seeing the same thing? Maybe I'm just being unreasonable and crashing out here, but it just doesn't make sense to me. Please drop a comment.
I'm seeing that. And there's a lot of other families across the country, especially right here in Maine, who are also seeing that and considering that very thing. Slide 5, please. This is my monthly healthcare bill. I blurred out the name of the group and all of that stuff, just stuff that people don't need to see. But you'll see payment amount, $1,641.09. That is for health coverage for me, my wife, and my daughter. That's it. Now, I'm incredibly lucky. I have my own business and, I have to pay for my own health insurance. But I want to show you a personal example of what I have to pay without a government subsidy, without anybody paying for it, to actually realize any health insurance coverage for my family. If we can throw up slide 3, please. And I did this on Grok. I made this image just for our viewers. I want you guys to have high quality imagery here on the Garrett Mason show. So my yearly premium for my family is $19,790. The yearly deductible is $7,000 per person. And the out-of-pocket maximum, they give you a deal here. It's basically buy 2, get 1 free. So if you meet $14,000 of your deductible, then that's all you have to pay. So I have to pay $33,790 out of my pocket before there is any coverage for me and my family, for me ever to see a bill that is paid for by my health insurance company. That's real life. That's what a lot of people are going through all over the country. Let's rewind and talk about why this is. It's the Affordable Care Act, the complete joke of a law that was passed in 2010, I believe it was 2010, under Barack Obama. The Affordable Care Act, its purpose was simple. It essentially took the Massachusetts healthcare law that was passed by then Governor Mitt Romney, former governor, former U.S. senator, and they took it and morphed it into a federal behemoth. The idea was this, and you'll remember, I'm sure you remember, Barack Obama saying, if you like your doctor, you can keep your doctor. And what he was essentially saying is that health insurance wasn't going to change. The government was just going to subsidize it. But health insurance changed a lot. They forced coverage of a ridiculous amount of things and forced you into a one-size-fits-all behemoth that was backed by the government. The hitch by this was that they were going to take your premiums, whatever they were, and depending on how much you made, they were going to subsidize that premium in order for you to afford it. The ones who made out the most under Obamacare were the health insurance companies. If you look at graphs going back from when the Affordable Care Act was introduced up until today, and you look at their stock price, it is a straight up Everest-style mountain graph. They have made so much money off of the Affordable Care Act. And why wouldn't they? They can continue to raise premiums without any threat of the government because the government will backstop that premium. In 2020, when COVID was raging, the Biden administration decided that they were going to hide the fact that the Affordable Care Act was continuing to cost people a ton of money, and they introduced enhanced subsidies for people because health insurance costs were going out of control. Democrats controlled everything, and they decided that they were going to sunset it for this year, that those premium subsidies were going to go away this year. Now that they have, you've seen premiums skyrocket. And Democrats are finally being exposed for the fact that they have destroyed healthcare in this country and have made it financially unattainable for nearly everyone who isn't super rich. And this was done by design. The design of Obamacare was made to destroy the private healthcare industry and force everybody into universal single payer. Now, I think that there is some places that the left and the right can come together on healthcare. I think everybody agrees that the system is radically broken. But I can tell you this, I have no use for universal healthcare. In fact, we just learned today that universal healthcare advocates are going to try to get it on the ballot again here in Maine. And they're going to try to force everybody into a universal healthcare style system. We have a really good look of what universal healthcare looks like. It looks like the pandemic, where if you don't take the vaccines that they want you to take, you can't get healthcare, or maybe you can't go to work. It looks like if you don't take the experimental drug that we want you to take for your, whatever ailment that it is, then you can't get any more medical services. That's what single-payer healthcare looks like. You only need to go as far north as Canada, which isn't too far away, to see the hellscape that they have in healthcare. In fact, a few years ago, it made the news. The premier of Newfoundland and Labrador couldn't get a service that he needed. I think it was like a cancer diagnosis or something. And he had to come to the Northeast to get the services that he needed. Universal healthcare is not what we need. We need a functioning healthcare system in this country. And the Affordable Care Act has done nothing but destroy it. You only need to look at the premium increases. In Maine right now, we're looking at a 18% premium increase. That's completely unaffordable for most families. And with the subsidies going away, it exposes the real truth that the ACA is a scam and that it needs to be repealed. I was watching Meet the Press last Sunday, and Kristen Welker was pressing a Republican senator on this issue, and that we need to keep these subsidies going, and we need to make sure that Americans don't see massive increases on their health care. And the response was from the senator, well, we need to repeal the ACA. And Kristen Welker pushed back and said, well, Republicans haven't provided an alternative. The alternative is to not have the ACA. I don't think a lot of people realize this, but before the Affordable Care Act was put into place, you could buy a catastrophic plan that would cover certain things. You could even have an a la carte plan where only certain things were covered. Like you could do doctor's visits, or you could cover this coverage, or whatever. You could pick and choose and kind of build your own policy. That was allowed, and it might cost you a couple $100 a month. But now, under the ACA, what most people, including myself, are paying for is a catastrophic policy plan that costs you, in my case, almost $34,000 a year. It's absurd. It's ridiculous. We don't need an alternative to the ACA. We need to repeal it so that the system has room to breathe once again. It's an absolute joke that we're going through this. It has been caused by Democrats. They are the ones that have started all of this 15 years ago when they destroyed the healthcare system. Now, going back to the shutdown, Democrats are starting to realize that there's consequences to their actions. Democrats are starting to realize that if they don't vote to open the government, there are going to be some constituencies that are going to be very upset with them. We learned this week that if we do not end the government shutdown, that 40 million Americans are going to see their SNAP and WIC subsidy not paid out in their account. Now, we have had a lot of discussions in Maine over the past 20 years about the excessive abuse of the welfare system here in Maine. And we can continue to have that discussion, and I'm sure we will. We need to also have it at the federal level. We need to have work requirements for some of these programs. We need to make sure that the ones that are getting it are the most vulnerable. It needs to be children and the elderly who are beneficiaries of these programs most highly of all. But what's happening right now is there's going to be a lot of people who aren't going to have the benefits that they rely on. And for a lot of those people, the constituency for those people usually vote Democrat. And for once, Republicans are finally putting a communications offensive on that shows people that it is not Republicans who are holding these benefits back. It is Democrats. Now, you bring that here to Maine, and once again, Senator Susan Collins, fighting for Mainers, once again, has sent a letter to the Secretary of Agriculture, Brooke Rollins, trying to find a way forward that even through the government shutdown, we can provide these benefits to people, including 170,000 Mainers, 50,000 of those who are children, and 73,000 of those who are older seniors, trying to find a way forward to make sure that these benefits get paid out. But Democrats could simply come in and provide the 7 votes that we need to reopen the government and get these crucial benefits for the less fortunate out to them. But they won't. There's also going to be a lot of people who are going to have to go to work, essential personnel for the government who are going to have to go to work and not get a paycheck. People that are in the military. The other one that I don't think a lot of people think about is air traffic controllers. I'd like my plane to land on time and safely. And we've seen what a complete disaster Pete Buttigieg turned the Federal Aviation Administration into. Thank God we have Sean Duffy trying to clean that up. It was because of them that we had, airliners crashing into Black Hawk helicopters over the Potomac. But those people are going to have to go to work and not get paid. All because Senate Democrats want to make sure that illegal aliens get health care and they can continue their money laundering schemes in blue states to make sure that the bennies keep coming for the illegals. They will always go to the wall for the illegal, but they never will go to the wall for you. They will continue to keep the ACA in place and force premiums to rise all over the country. But they'll make sure that the tap is turned on for the illegals. That's what you're dealing with here. And that's what this is all about. I showed you the language. I showed you the gaslighting from the Democrats. This one is on them. There's no question about it. But what do we do? What do we do? Here in Maine, we actually have one of the most restrictive healthcare laws in the entire country. Other states have found solutions. They've been tried to be brought to Maine to no avail. And now, in full disclosure, I did some work on this bill in the last legislature, and it's a bill that's still alive. But, there are solutions to our healthcare problems. The Farm Bureau of Tennessee offers not health insurance, but they operate a health plan that they help other states start, other states' farm bureaus start. You don't have to be a farmer to be a member of their farm bureau. Just join the Farm Bureau. And they provide a health insurance product that operates very much like life insurance. Everybody knows when you get life insurance, you have to go. Sometimes you have to get a blood test. You have to get a physical. You have to make sure that you're fit and that they're taking a good risk on providing you life insurance. This operates the same way. You got to get pre-vetted. You got to have, get checked out. Doesn't mean that your premium's going to be denied. Doesn't mean that you won't be able to join the program. It just means that they want to make sure on that you are eligible for their program. Might have to pay a higher premium, maybe not, if you have something wrong with you. Premiums usually run somewhere under $1,000 a month for a family, way lower deductibles. No out of pocket, no maximum on payout. So if you have something horrible that happens to you, you can, have coverage up to the amount that you need, which is not like you have under Affordable Care Act plans. That bill has been brought forward in the Maine legislature many, many times. We've had multiple farmers testify that this would save their farms thousands, sometimes up to $9,000 it would save them. It would allow their spouse to come home and work on the farm if they were able to have something like this. But there are some Maine Democrats who don't think that you're smart enough to be able to navigate that option for you and your family. That's an option that can bring premiums down and give you a product that you can afford. In fact, there's also other programs that people do take advantage of in the state of Maine, like Christian healthcare sharing ministries, where you share the cost of healthcare amongst believers. But there's Maine Democrats who want to take that away from you as well, that don't think that that should be allowed. In fact, many of them have called it a quote unquote scam. Imagine that. A Christian healthcare ministries program that shares the costs of medical burdens And the response from Maine Democrats is that it's a scam. It's a scam when you open up your envelope and there's checks in there for your payment combined with prayer requests. That's a scam. Absolutely absurd. Instead of trying to make healthcare more affordable in Maine, Maine Democrats have done everything that they can to make it more expensive. There are solutions out there for us, for people to have. There are better options for people to have, even in the face of the destruction of Obamacare. And yet there are some Maine Democrats who don't want that for you. We must do something about healthcare. But I can tell you that providing healthcare to illegal immigrants is not the way to fix the problem. It's actually a really great way to bankrupt us. So my advice to Senate Democrats is to reopen the government. Stop playing games. Stop playing games with people's premiums. Stop playing games with people's budgets. Stop playing games with the less fortunate's benefits to eat. Stop playing games with Americans' travel. And go to work. Figure out how. Actually, you don't even need to figure it out. The plan's already there. Fortunately, we do have a federal delegation, most of them, who have voted in favor of a clean continuing resolution, a clean path forward without funding illegal immigrant health care. Congressman Golden, Senator Collins, Senator King have all voted to reopen the government. Shelley Pingree couldn't be bothered because she's too busy clipping garlic in her greenhouse on North Haven. But thankfully, we do have 3 members of our delegation who are doing the right thing. The healthcare crisis in America, and especially in Maine, is at a fever pitch. And we have to figure out solutions for American and for Maine people. Well, thank you for tuning in today. I hope this has been informative. And I hope you've learned a little bit about what your government is doing, both here and in Washington, D.C. And I hope that you will subscribe to our channel on YouTube. I hope that you'll download our episodes on Apple, Spotify, wherever you get your podcasts. Follow us on social media. We've had a lot of fun doing this, and we're hoping to do it for a lot longer. But we can only do it if you subscribe to our channels. So that's my take. Hope you'll join us again next time. And don't forget to vote. Election Day is Tuesday, November 4th. I'm voting yes on 1, and I'm voting no on 2. And I hope that you will as well. So thanks for tuning in, and we'll see you next time.